the Black Death disease. The Black Death disease started in Europe, then spread to Central Asia in 1348 and 1358, before going west. The symptoms of the Black Death disease start with a headache, then chills and fevers, nauseous, vomiting, back pains, soreness in the arms and legs. Bright light was even too bright to stand. Within 2 days, the swelling appears. You will get sores on your hands, legs, and all over your body. Your nails will turn black and start to peel off, as well as on your toes. After somebody dies of the Black Death disease, a custodian, which is a person of death, would go and pile them in another pile of the people who died from the Black Death. They would all lie in this pit until archaeologists would find them many, many years ago. The Black Death disease is contagious. It can spread to anyone, even if touching them. When somebody dies of the Black Death disease, people would go around singing the song Ring-a-Ring-a-Rosy, which should be a school song for little children. But instead, it originated from the Black Death disease as Ring-a-Ring-a-Rosy would be the ring, which is contagious, of roses, would give them flowers after they die. A pocket full of posies would be the herbs to wear off the smell of the dead. A tissue would be the final sneeze. We all fall down is when they die, all in the pit. And that is the Black Death disease.
Dr. Preston has allowed us to see one of her patients who has HIV.
What? Jessica, how are you doing this morning?
I'm sick.
No. I understand that you have HIV/AIDS.
Yeah.
AIDS is caused by human immunodeficiency virus.
Melina, look up.
It's mainly transmitted through sexual intercourse, but it can also be, like in your case, that your mother had it and then she gave birth to you.
Really?
Yes.
I didn't know that.
You have been at this hospital for a very long time. Before you came, did you experience any of the following, which are the symptoms of HIV? Fever and night sweats, aching muscles and tiredness, sore throat, swollen glands, diarrhea, headache, sore eyes, or sensitivity to light?
Close the blinds!
I'll say, check to that. Put these sunglasses on. They'll help.
Wait. Gosh.
They're nice, aren't they? Tom Ford.
Ow, paper cut! Super paper!
I'm gonna die! I'm gonna die!
I'm gonna die! I just get to do things! I just want to do
She's dead! Man, everybody, rip my friend R.I.P.
Polio is a highly infectious viral disease that may attack the central nervous system and is characterized by symptoms that range from a mild, non-paralytic infection to total paralysis in a matter of hours. Poliovirus can spread by direct exposure to an infected individual and more rarely by eating foods contaminated with waste products and from the intestines, feces, and or droplets of moisture, saliva from an infected person. There's no cure for polio. The focus of modern treatment has been providing relief of symptoms, speeding recovery, and preventing complications.
I think so. Very careful.
careful with this incision.
Beep, beep, beep.
Paige, we got someone with tuberculosis upstairs. Let's move it! What seems to be the problem here?
This patient has tuberculosis. She came in this morning with her mother. She is very ill, but it's contagious. I'm going to inject her.
Administer the shot in the upper arm. Gently. Loosen up, child. Alright, you should be feeling better soon. I'll be right back. I'm going to get you a glass of water. It's okay. We'll get you through this.
Tuberculosis is a chronic infectious disease that usually affects the lungs. TB spreads mainly when someone with TB coughs or sneezes and someone else breathes in the airborne bacteria. Like that. You cannot get TB from handshakes, toilet seats, or sharing eating utensils, bedclothes, or clothing with people who have TB. The infection can also be acquired from contact with an infected cow or through drinking contaminated milk. However, this is an extremely rare way, as usually most milk is pasteurized. In the primary stage of TB, you don't have symptoms, but when the symptoms of pulmonary TB occur, they may include cough, usually coughing up mucus, coughing up blood, as this patient has, excessive sweating, especially at night, fatigue, fever, or unintentional weight loss. And you can see that patient has had some of those conditions.
Wait, stop. Wait.
Scurvy is a disease resulting from a deficiency of vitamin C. Symptoms of scurvy are spots on skin, spongy gums, and bleeding from the mucous membranes. As scurvy advances, there can be open separating wounds, loss of teeth, jaundice, fever, neuropathy, and death. Scurvy does not occur in most animals because they can synthesize their own vitamin C. However, humans and other higher primates, guinea pigs, most or all bats, and some species of birds and fish lack an enzyme necessary for such synthesis and must obtain vitamin C through their diet. Scurvy can be treated by eating food containing vitamin C, such as oranges, papaya, strawberries, lemon, tablets with vitamin C, etc. Chickenpox is a disease. Usually it is children who get the disease, but adults can also get it, though it is usually shingles they get.
Hi, I'm Dr. Jones.
Dr. Horatio.
Dr. Olson.
People who have it get blisters, mostly on the body and in the face. Those blisters are filled with a liquid. At some point they will drain up and there will be an urge to scratch. First blisters usually heal without leaving scars, unless people scratch them open, which leads to an infection. This disease can be very dangerous in pregnant women. Chickenpox is caused by a virus in the herpes family. There is a vaccine against it. Usually it is given to children.
Good morning and welcome to Medical Talk with Melina Preston. And we'll have Miss Makuyanjani all the way from South Africa. Give her Hello, ma'am. How are you this fine morning?
I'm good, thanks. I'm good.
You appear a bit sick.
I've got yellow fever.
Okay. So for those of you who didn't know, yellow fever is caused by a virus carried by mosquitoes. You can catch this disease if you are bitten by a mosquito infected with the virus. The disease is common in South America, and the sub-Saharan Africa. Anyone can get yellow fever, but the elderly have a higher risk of severe infection. You're rather old, aren't you? Old, aren't you? How old?
Well, to me, I appear so old, but you know, I feel aliveness. I don't know what I'm talking about. Okay, fine. I'm 70.
Alright, so the symptoms of yellow fever are irregular heartbeats, bleeding, comas, decreased urination, delirium, fever, headaches, yellow skin and eyes, also called jaundice. Like you have, as we can see, she has a bit of a yellow complexion. Is that
You see?
yes?
Yeah.
Muscle aches, red eyes, face, tongue, seizures, vomiting, and possibly vomiting blood. Did you experience any of the following that I just said?
Yes, I did. A lot of them at home. I was constantly vomiting. Oh my gosh.
No
vomiting
deals, thank
blood.
you.
Okay.
Alright, and that's all we have time for today. But tomorrow, please join us while we debate whether natural births or C-sections are better.
Malaria is an infectious disease. It is caused by parasites. People catch malaria when the parasite enters the blood. The parasite causes a deadly infection which kills many people each year. Some very common symptoms of malaria are fever, enlargement of liver or spleen, sweating, chills, delirium, comas, fast heart rates, low blood pressures, coughing, vomiting, and feeling very tired or sleepy. The parasite that causes malaria is a protozoan called Plasmodium. Protozoa are organisms with only one cell, but they are not bacteria. Bacteria are smaller and simpler than protozoa. People with different kinds of malaria need different kinds of medicines. The medicine that works for one kind may not work for another kind, so it is very important to know which species of Plasmodium the person has.
I'm Caitlin Leahy, reporting live.
Hi, I'm Liz Jensen. Nice to be here.
Oh yeah. Do you know what cholera is?
Yeah. You know, I just want to cut to the chase. I poo a lot. I'm just going to say that. I do. I poo a lot.
I'm going to explain cholera to you. It's an intestinal disorder. In other words, it's a disease. Are you sure you have that?
Yeah.
Well, the symptoms are violent vomiting, painless diarrhea, dehydration, and etc., etc., etc.
Wow, I'm really thirsty.
Tea. Oh, yeah, thanks. Okay. Questions from the audience. Yes, you with the sunglasses.
Thank you. How is cholera transmitted from
Cholera, what?
one person to the other?
Cholera is transmitted from the one person to the other by touching and eating contaminated food and water.
Contaminated by what?
I don't know, questions asked. Never mind. Okay. Okay, wait. Yeah. Don't you get diarrhea if you eat dairy products?
Oops.
Yes.
So your diarrhea is like a waterfall.
Yeah. It's like. Does anybody hear that sound?
Wow.
Oh my gosh.
Oh my god!
Oh, Jesus!
diseases bring me to the hospital. Damn right, it's pretty horrible. Damn right, it's pretty horrible. I have to treat them or I'm gonna die. You don't want them. The things that make people die, they slowly kill you inside. It's really bad. When you die, it's sad.
Okay.
Nah. They can be contagious. Nah. You don't wanna catch the nah. You gotta stay away from nah. Don't wanna catch it too.
One day I came home and I started vomiting a lot and I had really painful diarrhea. Like it was like poop and then it all just came out like
No, it's painless diarrhea.
painful. It burns your bum.
That's
It burns your bum.
I didn't say it burns your body. It doesn't.
Wake up! Miss Wise, how are you today? Sick. I understand that you have HIV. I'm going to explain to you. I'll say, check to that. You farted. I did it. I'm sorry.
Zachary is Luca.
I didn't fart.
Let's go for one. Oh my gosh, turn the
Gotta go to my house. Oh my God, Jess! Wait. Here, let me fix it. Stop filming.
You have to hold your leg up. You have to hold your leg up, otherwise it shows. Like, just continue going, guys. We'll cut that part out. Guys, seriously.